Hey guys, it's Dr. Emer, and we're doing one of the more popular treatments this year in 2019, which is non-surgical buttock augmentation. But we're doing something really unique today, which is why I'm showing this on film. We're doing a combination of two treatments, Sculptra, which is PLLA, or poly-L-lactic acid. This is a material that builds collagen over time to the area, mixed with a synthetic adipose matrix called Renuva. And if you look inside, you see that milky yellow color inside. That's a Renuva. It's basically synthetic fat cells from cadaver. And this helps build fat. And what this does is when you don't have a lot of fat, this utilizes cells to call in other fat cells to the area. So even though you may not notice the huge improvement right away, in the next weeks to months, actually the fat will build in this area because it is made of a material that calls those cells over. And so we dilute those purified fat cells with the Sculptra to get a little bit of a build here. And on my patient, we already pre-marked the areas of her concern while she was standing. This can help cellulite, this can help volume in the area, and you can see she already has a really nice curve. She's very fit, athletic, beautiful, but she doesn't have a lot of fat. So our goal here is to build the underlying fat in this area, and this is really good for people if they've had previous surgery, like a liposuction, or if they have cellulite that's challenging to treat despite doing Selfina and others. Squeeze again as hard as you can. Great, so now you can see even now that's already built. You want to go superficially in the fat layers and build this in strands.
Is this good for hip dips?
It's very good for that. The only negative to it is since this is a synthetic graft, you're going to have to do some kind of series of treatments, and cost is going to be a little bit more of an issue depending on how much you need or really what you want to do. Okay. So we're filling out this lower section for her. I do want to give a slight bit into the crease of her buttock here because that helps give definition to the roll just a teeny bit. And then the big thing is for her is building out that lower area where she has lost volume and there's some looseness into the tissue. So that's great, that's done.
Can you do this in the breasts?
You can do it, you can really do it anywhere that you need fat. A lot of doctors are using it after a breast reconstruction, little pinch on the other side, where they've already done implants or they've done reconstructive surgery and now they want to fine tune the implant, or if there's like an implant that has a little bit of rippling to it and you want to cover up, they want to camouflage the rippling. You can use it for a face. The study is ongoing right now for the temple area to build volume in that area. So we really want to do nice strands of this all into the areas that were of her concern so that really this can build over the next few months, and whatever result she gets is going to be permanent.
What's the typical cost for this procedure?
It depends on how many syringes and what you use. It can range from $1,000 to $2,000 per number of cc's. And so you see what we do is we put little strands throughout the area of concern, and then we'll massage that in right there. And now we'll integrate, and these are called matrix cells. So what these do is these will integrate into the tissue, and then they will call over new cells to build in that same area. And then over time, this will really build up the tissue.
Is this a one-time procedure, or should you do
You
this?
can. You could do it based on how much improvement you get. Some people need more volume, so you do a little bit. You wait 6 to 12 weeks, or if you want a little bit sooner and add more, and then you keep building from there. The idea here is to build for her.
Any downtime?
No real downtime. I mean, you usually will get some bruising and some swelling in the area because of the injection. And this material is like a paste. It's going to sit under the skin. You might feel it for a short time period. But you really, I tell people they really can work out. The one thing I don't want them to do is radio frequency treatments. I don't want anything to damage these newly injected fat cells.
And the patient is awake during
She
this?
is awake and doing very good. And then the last part is we're going to do, yep, a little bit extra to the roll again. And that's it. Perfect.
Can this get rid of small dents in the buttock?
Yes, you can. Small dents, indentations from lipose, cellulite. Do a light amount of massaging right here, and then I'm going to put her directly under red light to prevent any bruising. And if there is any bruising that develops, we would have her come back in a couple days and do V-beam treatment to get rid of the blood vessels. But now the next few weeks, this is going to build. So that's it. That's Renuva Sculptra combination for buttock augmentation non-surgically.